As we continue the wave of the Omicron variant in the province of Ontario and locally, joining me now to speak a little bit about its effects locally from the Cornwall Community Hospital is once again Dr. Lorne Scharf. Welcome back, Dr. Scharf.
Hi there. Thank you. Thanks for having me back.
Well, we really appreciate your time, Doctor. We know how busy it is at the Cornwall Community Hospital and how important your work is, so we appreciate you taking the time. So let's start with a little bit about Omicron. I mean, certainly we couldn't have predicted the effects it would have, but we are starting to see record numbers of patients admitted to hospital just because of the sheer number of people being infected with the virus.
Yeah. Yeah, well, it's too bad. At the end of November, it really seemed like we were sailing into the post-COVID landscape, and it seemed like the world was going to return to normal. I even went away for the weekend with my daughter and my wife and had a very nice little break. And then by the time we got back, this whole new thing started. So it's definitely changed the game, and it's slammed us right back down into the reality of the pandemic and the hard work and the crowding and the numbers and the volumes and the surgical delays and all the unpleasant stuff that's going along with it. Um, the big thing about Omicron is how contagious it is. So it's been a hard thing to fight because it spreads easily. It's hard to contain it at a hospital. It's hard to contain it anywhere, a school or any sports team or anything. So we're seeing it spread around a lot. And the good news is that vaccination still seems to be a very effective tool in terms of preventing getting Omicron or getting a severe case of Omicron, and especially the vaccination of the booster dose, the third dose. That seems to really, turbo boost the whole immune status of a person. So that's sort of the Omicron situation. We've still got a lot of Omicron in Cornwall. It's definitely we're not past it yet by any stretch. We're hoping that it's stabilized, but we're definitely at the top of it. If it has stabilized, we're at the top of that wave.
Absolutely, and you mentioned, of course, the vaccinations. Certainly, there's a prevailing sort of conception that Omicron is milder than previous forms of the virus. Certainly, we don't know if that's the case or if it's because of the vaccinations, but we are certainly, again, because of that sheer number, we're seeing a lot of people hospitalized with breakthrough cases, but also you mentioned the unvaccinated. So talk to me about those two types that we're seeing at the Cornwall Community Hospital right now in terms of needing care, in terms of those that are unvaccinated, but also those breakthrough cases.
Sure. Well, first of all, in terms of Omicron being milder, I mean, we all hear that a lot on CNN, and I don't know if that's really been scientifically proven. Omicron arrived into a population that was already very vaccinated or had already had a case of COVID. So we call that a very exposed population. And where it first developed in South Africa, it was also a very young community comparatively. The average age of that community is lower than the average age of Cornwall, certainly. So the idea that it's somehow a milder illness, I don't think that that's really a very scientific statement yet. I haven't seen any good proof of that. Definitely, it's more transmissible. And by the way, we still have Delta around. So even though Omicron, we sort of are biased to the optimistic idea that it's milder, you can still get Delta. There's still a lot of Delta in Eastern Ontario. So we're still seeing a lot of people getting sick with it. If you get a case of COVID, you're more likely to be sick if you have a bad immune system. And people who have a immunocompromised status are usually people who are doing chemotherapy, or they're on specific types of medications that intentionally reduce their immune system. So people who have a kidney transplant, for example, there are some patients who are treated with high doses of cortisone for various autoimmune problems. So anybody who's in one of these situations, of course, patients who have HIV, these patients run the risk of getting sicker, whether they're vaccinated or not. The vaccine is still beneficial to them. In fact, it may be more important for them. But if they get COVID, they run a risk of having a severe course of illness. So those are the patients, one of the groups of the patients we worry about. And then unvaccinated people, of course, are very likely to catch Omicron if they're around a case of it, because it's so transmissible. So if you haven't had the vaccine, and your kid comes home from school with Omicron, you can pretty much be sure you're going to get Omicron. I can't imagine not getting it. So those are the two groups you asked about. But just to be very clear, the vaccine still has an enormous benefit. You don't want to throw your arms up and say, oh well, if you can get it anyways, what's the point of the vaccine? That's not at all the case. A lot of things we do in life are done to make us safer, and things don't come with guarantees. I think that one of my pet causes, one of the things I was actually passionate about before the pandemic, it's hard to even remember what life was like, but I was always a very big bicycle helmet advocate, and I believe in bicycle helmets being worn by anybody who is able to ride a bicycle, because if you have an accident, it reduces the risk of a serious head intracranial injury by about 85%, which is a huge effect. So, but it doesn't guarantee you won't have a head injury that will be very serious. So it's like a bicycle helmet. It really helps make you safer, and it really does have a huge benefit. But like a bicycle helmet, it doesn't guarantee anything. So, but if everybody wore a bicycle helmet, one thing is for sure, we'd see a lot fewer people that had serious head injuries. And if everybody had a vaccine, we'd have a lot fewer serious cases of COVID. And, the tragedy of COVID right now, sorry, I hope I'm not rambling on too much, but the tragedy of COVID right now, what's killing me is that it's not allowing us to do the stuff we need to do here at the hospital. We're having to delay surgeries. We're having to postpone tests. There are people out there waiting to have their cancers operated on and staged, and initiating therapy, and people suffering with hip pain, waiting for hip surgery. So there's a lot of people whose treatments are being affected because we're just so busy taking care of patients with COVID right now. So that's my situation with vaccines. Please, if everybody had a vaccine, we would be in much better shape.
Absolutely. It doesn't get much clearer than that. And I want to talk a little bit on that last point as well. You talk about the delays of surgeries and the other ripple effects of this. And of course, obviously, the more vaccinated people, you just said it, the less strain on the resources. I want to talk a little bit about those resources because, again, I think a lot of people, we don't realize what goes into treating COVID patients at the hospital. The resources, not both in terms of medical and human resources. Certainly, I know off camera, you're telling me you're on call right now. When people have issues breathing, you're the one that has to run and help them. So talk to me a little bit about that strain on the resources.
Yeah. Well, my day-to-day is actually very interesting. So part of our strategy with controlling COVID is to make sure that we're very careful with patients that have COVID. And one of the things we have to be very careful about is when patients get short of breath and we start giving them certain medications or helping them breathe. We don't want to spread the COVID. So we have designated people in the hospital every day now who respond to patients anywhere in the hospital who are needing more oxygen or feeling increasingly short of breath. And we're doing that really to just trying to make sure that we do a good job with infection control. And we call those, these controlled code situations where everybody who responds has special training on how to not only respond to what's wrong with the patient, but keep other patients and hospital staff safe. So that's what I'm doing today. So the whole landscape of COVID has changed what we're all doing. I guess on a positive note, it's definitely made us do a lot better job with, washing our hands and wearing masks and wearing face shields. So a lot of the things we're doing, it's been a very nice sort of reminder of how important it is. But yeah, we're wearing our masks all day long and our gowns. And so it gets a little bit tired. There was, I was on Facebook this morning, somebody had a post from the New Yorker magazine about how they had to take a flight from Los Angeles to New York and they made them wear a mask for 5 hours straight. Well, I can tell you, we have over 1,000 employees here that are wearing their masks for their whole shift for 2 years now. And the masks that we wear in the emergency room and when we deal with patients are these masks that are N95 masks, and they have double elastic straps, and they stick to your face very hard. They really push your face. and leave marks on it. So it's definitely not fun, but it is extremely important, of course. So that's some of the ways work has changed. What I can tell you though is that our staff have really been superstars. We've had staff get sick. We've had staff like everybody, they have sick children at home, they have sick parents. So they're all dealing with their own realities of life, but they've been resilient and professional. They've had to deal with being redeployed and reassigned to different types of work. We've taken staff that usually work in the operating room and put them in the emergency room, and we've changed things that people are being asked to do. We put them in situations where they might catch COVID, right? So, I mean, nobody wants to even walk past somebody with COVID when you go to Costco. So I mean, telling a nurse that she has to take care of 3 COVID patients and administer their medications every 2 hours, and it is a risk to us. But I'm very proud of the job we're all doing, and by using our protective equipment properly and wearing our masks and our gloves, and the fact that we're all fully vaccinated has helped keep us safe. So we're not. So what we're dealing with the most right now at the hospital are these large numbers of cases that are being admitted, and the fact that we're having to reassign staff to different areas. So the staff are dealing with it. The patients are receiving the emergency care that they need, but it's affecting their other stuff. And we're really looking forward to getting past this.
Absolutely, and certainly as a community we are as well. But I know I'm thankful for the role that you and the staff at CCH are playing in this. Not to put you on the spot, but I know right before the interview you apologized and said, "I'm sorry, I have a mark on my face. I just took off my N95." It just makes it hit home, right? What our frontline staff is going through on a daily basis, and certainly that message is so important. That the best way we can help our frontline workers, if we haven't already, is to go out and get those shots, whether it's first, second, third, and all 3. So on that note, Doctor, I'd like to thank you so much for joining us again. We appreciate you taking the time. Such an important message to get out there to the community.
Thanks for having me. And again, just to give the community the message that we're here for you. If you need to be here, it's a safe place to come. And the staff that I'm talking about, we're still all really proud to be working here, and we're here for the community. So thanks for having me, and it's really a pleasure again.